to Savita Dental College Lecture Cast in Dental Implantology. Today we shall talk about how to fabricate a 3-unit implant supported bridge, hybrid and an overdenture implant prosthesis. Before going in detail about how to carry about these procedures, we need to have an overview about how to plan in selecting a patient, placing an implant and how to restore an implant site. So first let's talk about single tooth implant. So how do we replace a single tooth missing area? So first it's divided into cement retained and screw retained. And next partially again it's divided into cement and screw retained. And these are the example. On the right it is a screw retained and on the left it is the cement retained. Now we shall discuss about in detail how a cement is different from screw retained. In cement crown, it requires a two-piece assembly. An abutment is attached to the implant with the screw, as you can have a look at the diagram which is there on the left hand side, and a crown is then cemented onto the abutment. In screw retained, it requires a one-piece assembly. A crown is attached to the implant with the screw. And the advantage of the cemented crown will be it looks like a natural tooth and aesthetically pleasing, unlike screw retained, which is not aesthetically pleasing. The disadvantage of cement retained will be cement can cause inflammation and bone loss, and removal options are limited. But disadvantage of the cement retained crown, the crown may chip near the access hole and cosmetic is not a. Next, how to restore a implant site. As we mentioned about in the stage 2, we need to remove the healing cap and then incorporate the temporary crowns. While incorporating in the anterior region, we need to create an emergence profile for the aesthetic purpose. Now the lab procedures. So first we need to create a wax pattern. As you can have a look at the blue arrow, this is the wax pattern. At the top of it, that the yellow arrow which is pointing is the sprue. So once we are done with it, we need to cast it. And after casting, we need to trim and polish the metal. Once this is done, we need to build up the ceramic, polish it and then have a look at how it looks in the patient's mouth. And now completely edentulous. And these are again divided as an attachment retained. And these are the overdentures which were mentioned in the previous classes. The implants can be placed as we have shown in the diagram. The first diagram shows it's a non-splintered attachments. And next is the splintered attachments. And in the maxilla, the splintered attachments where 4 implants are placed. And these abutments, it can be divided into locator abutment and the ball abutment. Usually locator abutment are used when the implant is angulated. So up to 40-degree angle corrections can be done. Whereas the ball abutment, it's designed to accommodate the maximum denture bearing area and it's available in multiple retention options and it can be replaceable. This is the example for a locator abutment and this is the example for a ball abutment. And these are the examples which these cases have been done in our college, which is again a bar type and this is bar with the clip type. And now comes the full arch hybrid prosthesis. And these are, the patients are selected accordingly to how many implants can be placed. And this is a stage 2, once this is the, and these are the impression post. And once this has to be stabilized with the floss and then a patterned resin. And the impressions has taken here, and we have spoken about the impression can be taken in 2 techniques, that is the open mouth and the closed mouth. These are the verification jig where the arrows are pointing. This can show how the implants have been placed and where the final restorations will lay. Occlusal rims has been constructed for the complete dentures. Once this is done, a wax pattern has been constructed. And this is the wax pattern, and this is the trial, and the final process have been delivered. And this is before and after. These are the simple procedures by looking at, but we need to go in detail about how it is done. By saying this, we conclude the class. Thank you.